Hello and welcome to the IdeaCast interview series, episode number 161. My guest in this episode is Dr. Jessica Singh, and Dr. Singh is a certified sex therapist and clinical sexologist specializing in the intersection of sexuality, nervous system regulation, and eating disorder recovery. She's also the author of a forthcoming book as of this recording called Nourishing Desire. This is a groundbreaking exploration of how control, trauma, and body disconnection shape sexual desire. And we will be covering, the majority of this conversation will be covering that book, Nourishing Desire. And I read it. I will offer my thoughts on the book in this conversation. But suffice it to say that it was a good, informative book relating to eating disorders and sexual dysfunction. So it's an important publication, in my humble opinion. I very much enjoyed having Jessica as a guest, and hopefully you will enjoy the conversation. And I appreciate you all being here, too. Thank you very much. And I'd like to welcome Dr. Jessica Singh to the IdeaCast interview series. I'm looking forward to this conversation, and I hope the audience is prepared for an interesting conversation that revolves around mental health issues, and perhaps I'll attach just the tiniest little caveat that we are going to be discussing issues of intimacy, mental health, and interventions that correspond with that. So just a note to the audience, but I do welcome all of you, and you all have been with me before, and we've had some very serious conversations about mental health. You're used to it, but if you're new to the channel, just want to let you know this is going to be one of those conversations that's very productive and very informative. And we are also here to celebrate a forthcoming book that Jessica has coming out the week of this recording. So if you're watching this in 2 years, it will be kind of irrelevant. Nourishing Desire is the name of the book. And Jessica's going to tell us about that. But before we go into the book, I want to ask Dr. Singh to talk a little bit about the background that brought her to where she is right now, and what helped provide the genesis of this book. So I will hand it over to you, Jessica, and you can keep us informed on where you're coming from and what's going on.
Oh man! So the beginning of, first of all, thank you for having me on, Justin.
Of course.
So to answer that question, I have to go back quite a bit because I really started to get interested in mental health during my own eating disorder recovery. That began really over 15 years, culminating in my last inpatient treatment in 2003. Okay. And it was from there, and trying to understand my own story, that I started to learn more about psychology, get more educated on that. And then it kind of branched out to other people. And I realized I really wanted to help people who were also struggling, not just with eating disorders, but with other things. So when I eventually became a licensed clinical social worker and a sex therapist, I was working primarily with eating disorders. And I noticed a lot of the same themes coming with the people I was working with. That was trouble with intimacy, not just sexual intimacy, but emotional intimacy. And no one really understood why that was the case. And it's not something that's talked about within eating disorder treatment, but it seems to be pretty rampant. So that got me to researching more about that. And that became the topic of my dissertation when I eventually got my PhD in clinical sexology. And that's really the basis of the book, was that doctoral research. It's a little bit more, it's less clinical in its final form, and it's definitely more reader friendly. But that's what got me there.
Okay. Now, would you consider yourself an outlier in the field of either sexology or the study of eating disorders, that you've done a kind of a convergence project or a synergistic project with the two morbidities, or however that's gingerly said? Yes. Or is this an emerging field where we are seeing that overlap and that convergence working synergistically?
I'm hoping it's emerging, but there's not a lot of information out there. I'm seeing more and more as we move along. But there doesn't seem to be a lot of information out there right now, which is why I forced myself to talk about this. And this is why I wrote the book. Yeah.
Mm-hmm. And I would intuit, because I'm totally ignorant about the depth of what's going on both in sexual dysfunction and eating disorders, but that there's there's a need for that, a strong need for that. So I think that's really cool. And one thing I'll say to what you said a moment ago is that you have a superpower in having this kind of a priori knowledge, this lived experience of dealing with your own matters. And so that you can be a therapist and that you can be there for people. So in other words, for instance, on the other end of that would be that somebody just went through school and they learned and they may not have had those issues that they certainly could have had other things, but that you have that lived experience, I think is so important and so incredible, because the connection, I would intuit, is going to be better had, I think.
Yeah, I think it helps. I think eating disorders are not very well understood. I think there's very much the view that it is about food, it is about weight or body image, and it's about so much more than that. So when people don't have that information, that knowledge about what's going on with their bodies, like they tend to take shame from that. So they stigmatize themselves based on, what they're hearing from their environment.
Yeah.
So it's important to me to dispel some of those misconceptions.
Yeah, for sure. For sure. Before we open up the book and start moving through the constituency of the book, I want to, and I think I may have touched on this before we hit record, I want to share some of the excitement of a book release and what you're going through right now in terms, this is your third book. And if you have a little something you could say about that, because to me, I think it's just really exciting. Like this is nascency, this is Genesis, right? There's something coming into the world right now that people will have access to. And if it were a fictional book about whatever, that's one thing. But this is an instructive, life-changing work that you've done. So can you reflect on it? Can you pre-reflect on it, I guess is the right word. Can you share that affective space that you're occupying right now?
Yes, it's mixed emotions. I'd say, because there's a lot of excitement about it. So it's my third book, but it's my first traditionally published book. So this has a full global release and backing of a publisher, which definitely amplifies things a bit. So there's some excitement, particularly in getting this information out there to help other people. The other stuff, like being like me as a person out there, is terrifying. So I'm trying not to think about that first.
I can believe it. No, yes. I'm empathizing. Yeah.
Yes. Very much an introvert, very much like kind of want to be behind the scenes, but the importance of this work and this information, it definitely pushes me out of my comfort zone. Good. So I think that's more important.
Yeah, I would think I think the passion would or not quite passion, but whatever that emotive state is, the maternal drive, if anything, to see your new baby, be a success in the world. Hopefully that softens the introversion a little bit, because I understand that could be it could be upsetting. To be pushed out in these places, and I always try to identify as an ambivert so I can play both sides. There's times where I'm like, I
cannot.
Blah blah blah, and there's other times like I don't want to be around humans. I'm good. But anyway, I will say that and I will do full disclosure. I've read the book. I've got a couple chapters. I made it to 9. I told you that before we hit record. So how many chapters? How many are there altogether?
I want to say 13 or 14.
Okay, so I'm close, but I only had 2 days to read, so that's my excuse. But I loved the book. And I'm not just saying that because you're my guest, and I'm not just saying that because we're trying to promote your book. I genuinely love the book, and for a couple of reasons. It was well written, first of all. You communicate very well, and I want to not say that in a congratulatory way, but just to acknowledge that is what you will be working with if you get the book. And also the capacity for the book, I'm going to get weird philosophical, is to be dialogical with the reader. Especially if the reader is genuinely immersed in this experience of dysfunction, that this is a dialogical system, in my opinion. So you can read a book, it's third person, second person, whatever, narration, but with your exercises and with the interactive nature of the book, I consider it dialogical, so that there is the capacity for a stack of papers to really communicate with you more comprehensively, I think, than if it were sort of droll, instructive, like, a lot of research, citations, and you have citations and you have case studies, which I love. And I know I'm babbling here, but I love that you have John or, some of the other people that were in the book that were referenced, because I think that's an anchor for people as well, that they see the connectivity, they see the humanness, that you, the reader who is struggling, perhaps will not feel so alienated when you can make those connections. So there's my little book review, and there's my summation of what I experienced in reading the book. And again, I don't know if this is necessary to say, but I don't know if I'm struggling with eating disorders or that kind of sexual dysfunction. So I would say that for me, the takeaway was broader, and there's a broader sense of, and we'll talk about the tools you use in the book, but that I could connect with those tools that are being engaged with, and people will understand in a moment when I ask you to share some of the mechanics of the book. So that was powerful for me too, because it gave me pause for reflection in instances where I can see the mirror, and see the reflection. So long ramble, long babble, but like I said, I appreciate having experienced the book, and it was a good takeaway for me. So to speak to the mechanics of the book and the virtual machinery therein, dialectical behavioral therapy, and then there's it radically open or radically accepting?
Radically open.
Radically open dialectical. Okay. These are some of the underlying virtual machinery that's in the book and I use that as a metaphor for the discipline, that branch of psychology or that species. So I'll hand it back over to you to share with us that mode of practice and what it entails, and then how it sort of radiates through the book, if you don't mind.
Sure. So one of the shared mechanisms between eating disorders and sexual dysfunction is emotional regulation, and how we've learned to cope with our emotions. So it could be thought of as a spectrum of self-control. At one end of someone who's overly controlled, maybe very constricted, very rigid, very perfectionistic, rule following, all of that. The other end would be under controlled, which is a little bit more dysregulated, a little bit more impulsive, a little bit more expressive. So either end of the spectrum is not great for mental health. And we see the dialectical behavior therapy as being very effective as helping with under-controlled individuals to be able to regulate their emotions a little bit better, get them more centered. Radically open dialectical behavior therapy is great for someone who is over-controlled, at getting them to loosen up, be less rigid, be less constricted, be more vulnerable and open to experiences. So that's why they're related therapies, but their focus is a little bit different. So that's why you see both of them in the book, because whatever your symptoms are like, whatever your personality is like, or your coping style will tell you which of the therapies to use. So,
and I was in my takeaway of radical openness. It's almost like a conversation with oneself in terms of, as you said, I think was it over control that this is prescribed, better applied
for radically open.
Yeah. So that in this honest communication with self, to be objective and to sort of take stock or do an analysis or inventory or whatever of expression and perception and these things. And so I can see, the therapeutic value in that, in terms of, like you said, somebody who's going to be of those characteristics of over control. I think there was a quote or a statement in your book about anorexics being more on that end of the over control.
So we see the coping styles mirrored with both eating disorders and sexual functioning. So over-controlled individuals they tend to have more restrictive eating disorder patterns. So that would look like maybe anorexia nervosa. Over-controlled would be more impulsive, maybe binge eating disorder or bulimia nervosa with compensatory behaviors. And then sexually, it's very similar, where someone who's over-controlled or someone who has anorexia nervosa is more constricted with their sexual expression. They're a little bit more avoidant of sexual experiences. On the other hand, over-controlled or people with more impulsive eating disorder patterns they're more likely to have like riskier sexual experiences, more impulsive sexual experiences, and use sex to regulate their emotions.
Mm-hmm. Mm-hmm. Yeah. And regulate perhaps the reciprocal emotions, like the related emotions with the partner, like that this is a means of anchoring or securing or expressing.
Affirming.
Yeah. Yeah. Mm-hmm. Yeah. Oh, sorry, I got to cheat. Oh, I know. I'm looking at my sheet. I'm trying to like go 56
it's
years
a lot
old.
to remember.
I know. This is extended mind, people. This is what you do when you get middle age. But anyway, one of the neat, I think it was a chapter title or maybe it was a subsection, was saying the fallacy of partial recovery in this process of bringing oneself, from the throes. And so I love that because this plays into kind of dissonance or self-deception and and this sort of jumping the gun a little bit. So could you share that a little bit with us, because that was a neat takeaway from it.
I love that chapter. But partial recovery is very rampant with eating disorder recovery. So it's this concept of, I'm not sick enough to maybe get attention from other people or necessitate treatment, but I can still kind of keep part of the eating disorder patterns or whatever I'm using to regulate. So that happens a lot. So when we're still in, when we're in partial recovery, there's going to be some trouble with connection with other people, with that emotional intimacy, because it's still disordered. So you're still going to have some of the sexual effects from things like malnutrition or maybe unresolved trauma or some of those coping skills that are maladaptive. But it's not as, I don't think people notice it as much, or they think I'm not actively in harm, or it's not that bad, or it's not like it was, so I'm okay. But it's still very much an issue, not just with your body, but with your connection with others. And there's also people who have maybe never been diagnosed with an eating disorder, or it's never been to the level to be called maybe clinically an eating disorder, but it's still very much disordered. And you might still have some sexual side effects from that. Okay.
What would, if we have an audience member listening, let's hope, this is a tough question because, they may be in therapy, they may be working with themselves, but so if we were to transcend that partial recovery into a mode of full recovery, what would you list as maybe a set of 3-4 markers for where one could, kind of non-controversially feel like they're, or it's not ambiguous, like there is this sense of not completion, but whatever the right term is for being a recovered person. What would that kind of look like? And again, we have to acknowledge that this is coarse graining here, and we can't zero in on something because we're all unique and all those things that we want to account for.
Yeah, and it's hard to say, and recovery takes so long, so it doesn't mean you're not active in recovery just because you're having maybe certain symptoms or certain patterns. But things like, still trying to keep your weight at a certain level, maybe it's not quite underweight, but it's not really where your body wants to be. So still having that control, or still obsessively counting calories, or still obsessively checking in the mirror. Things like that.
Okay.
So it's still very much front of mind.
Okay.
Ultimately, yeah.
Okay. All right. So those impulses are
still driven by the same thing.
Yeah. One thing I appreciate about the spirit of the book is that knee-jerk reaction, typical member of our culture might say, oh, eating disorders, well, that's women, and it's blah, blah, blah. And sexual dysfunction, oh, that's women and blah, blah. I'm probably speaking as a guy, saying that, although, whatever my gender is, whatever. But the fact that I love, what you're covering in the book is that it's gender inclusive. It is speaking to what we would consider outliers. Like, if I look at the milieu of the culture, the only case I've ever heard of a man with an eating disorder was Billy Bob Thornton, the actor, maybe there was that other Christopher Nolan or whatever who did that one movie where he lost like 1 bazillion pounds and got really emaciated, and that must have really messed with his circuitry. But typically you don't hear cases of men or other genders struggling with this. And so you take the care to point out that this is comprehensive in a sense. But maybe a question that's embedded in that is, of the gender spectrum and of orientation and things that deal with sexuality, and then we bring food in, do you see a stronger cohort in places on that, vectors on that spectrum, or vectors in orientation with relationships? Is there anything showing in the literature or in your work and your research or your patients that show that there are, like spikes in places along those spectrums? In other words,
So we
cisgender women, is it, who are we seeing, if you don't mind?
Sure. So, first I'll say, like, the reason why I have the case studies is to illustrate that, because there's very much the idea that it is, young white women that primarily suffer, and that's not true. That's not true to life. But that is very much what's portrayed in media. So like this past, a couple of weeks ago, I was really excited because the HBO show The Pit actually had showcased a Black woman that presented with purging behaviors. And I was like, oh my gosh, I was so excited.
You have to celebrate, right? There's a reason behind it. Yes.
Yeah. Because we see all genders, we see all races, ethnicities that are suffering. But there is a large amount of LGBTQ plus individuals that present with eating disorders.
Okay.
Higher than maybe in a cisgender or heterosexual population.
Yeah. And I think, again, one of your case studies was, and I mentioned his name earlier, John was cis male, I believe, but dealing with, I think it was bulimia and body image distortion and things very like common. That. Yeah. So to put that out there to the commons, to anyone who's listening, that this isn't exclusive to any particular gender orientation or racial, I hate the word racial, but the, cultural background, that this is a broad spectrum for our species.
It's definitely more broad, and there are particularly a lot of cisgender men that are struggling in secret because of that. Because it's very much seen as like a female issue. It's again tied to maybe aesthetics unnecessarily, and the belief that it's about weight or body image, and that's just not the case. So I actually see a lot of men with eating disorders. Okay, and more than you think.
Yeah. I'm glad that's coming out too, because literally, coming out of wherever the darkness, that men, to speak to cisgender men, and which is something I guess I could identify with, is how that is supposed to be, abated or there's a disregard for that nuanced level of emotive expression or physiological expression or whatever it is that could cause these matters to arise, that we would have a eating disorder that could then either cascade into a sexual dysfunction or is part and parcel, entwined with a dysfunction. But, that men can. So in other words, I think, speaking again for, cis hetero men or whatever we're labeling, that they have that space that they can move. And I think and I'm speaking ageist here for a minute, I think younger generations have greater latitude for that. I think older men, that's conditioning. It's just social, what do they call it? Mimesis, the mimetic culture, that you were imprinted to be tough, stoic, brush it off, all that kind of stuff. So anyway, that's just a shout out to that, don't be inhibited. Don't be afraid, to explore that pathology.
And you're right, there's definitely a shift, I think, in attitudes lately. And I think, as much as I don't like social media, there's some value in that, because there's a lot of stories being shared. So you are seeing more men talk about maybe issues with disordered eating or issues with sexuality or sexual functioning. And you see all sorts of people. So that part's good.
It is. And again, I speak from someone who's ensconced in my age group, ensconced in, whatever my gender and orientation might be, that ours was more stifled and prohibitive, and this, and older generations, it was even worse, like people in their 70s and 80s, going back in time. It's just, I think so. In other words, I think there is a forward progression of this capacity for and again, I'm speaking for men, that cis men, that you're granted that space in the culture, or whatever we want to call it, to be vulnerable, to express yourself in vulnerability. And I see that expressed, and I'm going on a tangent here, so I apologize, but just this might be a moment for, someone's listening, to have that security and just say, it's okay, be who you are. And then if you needed help or an intervention, and that goes across the spectrum, of course, we'll go full circle here and go across the spectrum, but just wanted to have that one moment there because I can relate. I see it. And I'm encouraged. Like you said, social media is facilitating that. But I just think, cis men under 40, are being brave and being themselves and being more diverse in that expression, so that they don't have to play that hyper masculine role or play the archetypal embodiment type stuff. And if they want to, that's fine. But if you don't, then don't fear that space.
Yes, I love that.
Done with my tangent. So sorry.
It was relevant because,
right,
especially touching on vulnerability.
Yeah, and it can come back to full inclusivity and just say, hey, you're a human being, whatever's going on.
It's all good.
Right. If there's something going on with your attitude and your relationship with food, or your relationship with your intimacy and your sexuality, then that's I'd say birthright. I'd use that strong of a word, because I think you talk about this in the book, that from infancy we are molding and being informed about sexuality and about our relationships with everything, including food and all these things. So it's a lifelong thing that we deserve. We deserve to eat well and to love well and all those different things. Sorry, I'm just running out.
No, I like it.
Okay. I'm done with the manifesto part now that I did my my little thing. There's also a tripartite system in the book that I liked, and I think it was emotive. It's a Venn, and it's rational, and then there's the wise. So we have three circles, and there's emotive, rational, and wise. And this, I think, has overlap with the radical openness and learning discernment, learning oneself. So I'll hand that back over to you. And if you want to share that as another sort of virtual mechanism or tool that I think is really powerful, that's coming out of your book.
Sure. And that's really all about balance, because if we're talking about like the radically open and over control, there's a shift from we tend to see like two extreme states where we're in that perfectionist, in that constricted space, but then something happens and we kind of snap, and then we go into this mode of just like, forget everything, nothing's worth it, and we kind of, lose the plot. So the middle spot is where is really the best mind state to be. And yeah, so there's a similar mechanism for the under control, which is the more, I guess, being more in your head and then being more in your body, and like a good mix of the two is best.
Okay.
Yeah.
I like making connections. So we had talked about radical openness earlier, and now we have the Venn of the rational, the emotional, and then the synthesis, if I can, synthesis of the wise. And I think that could bring us back to, you have 10 steps of radical openness in your listed in the book, which I think is really cool. To me, it's like a lodestar or a guidepost, to check in with yourself. Like we were asking a little while ago, like the fallacy of partial recovery. Well, what does comprehensive or progressed recovery look like? And those 10 steps of radical openness, I think, impressed upon me that this is a kind of way of checking in with oneself for one's own configuration of their complexity of who they are, but that's a nice little mechanism, I think, to grant oneself the assurance that they are making progress, or they are healing or recovering. right? Like the meaning aspects of the 10, the list of 10. I think meaning was brought up twice in the list of 10. I could be wrong. But anyway, but that list is powerful in terms of that idea of the wise circle.
Yeah.
I'm making connections here, like the wise circle, right?
Right.
And we're moving maybe, again, the power of the emotional self is good, but there's also a shadowy thing. I guess it could get hijacked maybe. And so that's where, rational keeps that in check. And,
keeps it centered. Like really a lot of it comes down to balance.
Mm-hmm.
Like being aware of what your patterns are and bring yourself back to center in all aspects. That's where a lot of the exercises come in, a lot of the tools, as like a tangible way to check in with yourself and to correct some of these learned coping styles, learned coping skills, and I guess refocus it on ones that actually work in the life you're living now. Because a lot of these things are learned previously through maybe a difficult childhood, through trauma, through difficult relationships, what have you. And we're still using them even though they don't work anymore. They worked at a certain point in time. They were adaptive then, but they become maladaptive when our environment or circumstances change, but we're still doing the thing.
Okay.
So a lot of the exercises is for that. Like the 10 steps to radical openness is about like, okay, maybe before we couldn't really be vulnerable. We couldn't be open to experiences because for whatever reason, we were told we have to keep a lid on that, but we don't know how to do that because we were never taught and we don't have the practice. So this is something, step by step, you can learn how to be more open to experiences. So, and that's for experiences of all kind, relationships of all kind. In the book, it's specifically talking about, sex and sexual intimacy, but it goes, far beyond that. It's all relationships with all people. Yeah.
So this is a question that's sort of more organic from me, but it was an extraction from the book. And in the book, you talk about with matters of intimacy and sort of sexual well-being, that we have you list some suggestions and exercises for starting with oneself for moving into that space where we are less fearful, we are more trusting, and it could be something as simple as just palpating oneself. To varying degrees, right? You can palpate, to a blissful state or a release, but I want to take that was covered in the book, and I'm thinking about recovery from eating disorders. This is me being completely folksy, naive, and intuitive, and I was wondering in the idea of recovery from one's aversion to eating, one's even almost to the point of maybe disgust with food and the relationship, and these gustatorial responses that are not positively valent for the process of consuming, is can we reintroduce, I'm trying to think of a nice way to say it. I'll start with another angle, like when one is anhedonic, when one is inhibited or shunted from the capacity to savor, to enjoy, right, to make this a sensate experience or even a sensual experience of eating. Are there modalities or, like prescriptive moves that can be made to have someone experiment with the olfactory sense of bringing in the smell of fresh bread or, and reintroducing that I don't know if hedonic's the right word, but that response that's the same as this is why I brought up the body and the sexuality is like, I'm trying to do, again, connection, overlap. Are people doing that with sense, taste, sight, like seeing a really beautiful piece of fruit or whatever? Is that part of the recovery?
It can be.
Long question, sorry.
Yeah, it would be called gradual exposure therapy. Okay. So it is something that happens, and it is pretty necessary for eating disorders in particular, because if you try too much too soon, it's very scary. We're going to pull back. So starting small is important. So that could be like with sensations, with fragrances, with heat, with textures, things like that.
Okay. I was
Absolutely.
intuiting that, and I thought,
Mhm.
well, that would be interesting. And then going back to anhedonia for a minute, in depressives, in people with pretty strong measure of depression, I know that anhedonia can hijack one's intimacy and one's
Mhm.
sexual expression. Is that which shows up in the domain, again, overlap of eating disorder and sexual dysfunction? Is anhedonia part of that? Is that a different species when we're talking about a depressive who is shutting down somatically, not responding somatically? Is there any connection there with those things in that we
It can
find?
be.
Okay.
It can be because sometimes what we'll find um, things like anxiety that cause like a shutdown of
Hmm.
emotion, of pleasure, of anything, is very much present. And a lot of that is just like it's like a system that's just overwhelmed. So
Hmm.
there is some numbing
Okay.
that happens. And that's essentially the body going into fight or flight, but it's more like that freeze response, fight, flight, freeze, fawn.
Yeah.
It's a freeze response.
Okay.
So when anytime the body fight or flight mode, it shuts down any processes or systems that are not necessary.
Hmm.
So one of the first things to go is the reproductive system because that's not necessary for survival.
Right.
Yeah.
Right. Okay. So when one is in therapy for, let's say, sexual dysfunction, is just like the food thing where we're reintroducing one's appreciation, a basal appreciation, not just like a metacognitive appreciation, but this kind of,
Mm-hmm.
again, you smell fresh baked bread or a little bit of garlic that's been roasted, things that make me go through the roof, right? Is this is again going back to maybe the touch therapy with a trusted
Mm-hmm.
intimate partner that you can co-palpate, or you can, so to
Yeah.
bring that back up and try to refamiliarize or reorient that.
Pretty much, yeah. So
Yeah.
if it is more like that fight or flight response or the
Right.
freeze, we'd have to increase feelings of emotional and physical safety.
Okay.
So
Oh.
it would be grounding, be relaxation, just to feel well within yourself, and then you'd have to then work on being safe with another person.
Okay. I had another really mm, well appreciated takeaway from the book that I want to share and have you elaborate on, and that was that when one is moving out, whatever the metaphor is for recovery, from either of the two morbidities or whatever, the eating and the sexual uh, malaise or dysfunction, is that when one is emerging or transcending, that the personality changes, the character changes, the expression and presentation changes, the persona, whatever's going on, that this will not immediately be grasped or recognized by those in your orbit,
Mhm.
and that in itself requires kid glove treatment and recognition. So I'll hand that back over to you. Can you elaborate on that? And I think that's really powerful, right? Like that's one of those things that'll keep the rocking system rocking forward rather than rocking backwards. It's like all your
Right,
friends are like, "Who the are you?" Yeah,
right.
what? Who are you? So anyway, I found that really profound. In terms of moving oneself forward or extricating oneself. So
Yeah, so a lot does change. So I always refer to like the over control, under control as like a coping um, or spectrum of coping, but
yeah.
previously it was called more like personality traits. And
Mm-hmm.
I'm like, I
Mm-hmm.
don't think that's really a true part of your personality. That's just how we learn to cope, and this is how it is shown to other people. So as we're working on that and getting closer to that more
Mm-hmm.
balanced space, outwardly our personality could change, but it's really we're
Okay.
just lifting the veil of whatever we've been using to cope. So it tends to be a little gradual. I don't think it changes overnight because any change has to be,
Okay.
at one's level of comfort. Um, but I haven't noticed like other people in your orbit having like a negative reaction to that. I think if they do, that's probably a reflection of the relationship because
Mm,
it's just your true self emerging.
okay.
Um, so
But if there were if one is in recovery,
yeah.
um, let's lean on eating disorder here. And one has either intimate partners, or close friends. Um, Again, with that transformative uh, um, unfolding, is how do I frame this? Is it of significance that there are going to be remarks, there are going to be these um, notations made verbally, maybe with persons that you would consider to be trusted uh, persons in your life, and so this is kind of a reiteration of, and you've probably already said it, but it's just like I would assume, that we just want to have that resiliency salience up, right? To say, I understand where this is coming from, and I understand that they're not used to this expression of of me, right? So it's maybe it's not a question. I'm just maybe capping or just like trying to meditate on that for a second, because again, I think trying to empathize with somebody in that position who may have some vulnerability, who may have this like, this is all new to me, and this expression of myself, or how I'm expressing right now, or how I'm presenting is novel, and it's like to have somebody come along and say, oh, who are you? Yeah. It could go either way, right? You could be like, well, I am, or Jesus Christ,
It could be scary because that means you're being seen, you're being perceived.
Yeah,
people are noticing something, which especially with people with eating disorders, we don't always like that. To be perceived, because a lot of it is hiding. So that part can be scary depending on where you are in recovery. I think just as people, we don't always like someone to comment on our behavior or anything like that.
Yeah. And I have a loved one that's gone through metamorphosis and changing experience, or changing expression, and changing how they are. And that there's commentary within a family dynamic, and but this person is recognizing that and just saying, almost validating, saying, oh, well, if it's being noted by this person, and not necessarily in the most positive response, that this is sort of a validation, saying, well, I guess I am different than they perceive me to be, or would want to think of me as being. So anyway, it's interesting territory, I guess. To me, it's intriguing, right? That it's a hopefully a healthy provocation. Like when you think about immune systems and things, like if something like that comes up, that you can say, okay, I recognize this, and I see that how they're reacting to it. And that's cool. I'm secure and I'm okay.
Yeah, absolutely. Yeah. And consider the source, and if it's a criticism, consider the source.
Yeah. That brings me to a point, another mention in your book that I thought was profound and interesting, is that when it comes to body image, which you cover in the book, and the idea of our morphic potential, or our morphic variation, how we are sized, how we are shaped, and so forth, that even this kind of ties in what we were just talking about. A comment could be made to you, like, about how well you look, right? And oh, you've lost weight, or you've done this, or whatever. But I wanted to pull this out because I thought it was, again, profound, that even that kind of commentary can be received in a way that could be deleterious, or a setback to one's image, and one's curation of that image, and the tender loving care that's involved in that. So I don't know if you want to talk about that, or I just threw that out there as a for instance in the book that I think is a really good
it's a good. Yeah, I think so. I think people mean well when they say things like that. But I don't think there's any helpful way to comment on someone's body or weight. We never know how that's going to be received. And we don't know why, someone's appearance changes. Yeah.
Another big takeaway for me, that if someone's listening and they're interested because this is something that they're grappling with, is this is going into social cultural, the milieu, our society, and the youth fixation, again, morphology fixation, even age and gender and sex, but largely this I would call it commodification of the human form. That, Madison Avenue has an idea for what that model on a whatever, some designer thing, you see the perfume ads and stuff like that, or clothing or things like that, and how that penetrates our screen of perception. I wouldn't mind opening that up if you're interested, and just, we don't have to belabor it, but just, that's a powerful force. That's like a third actor, right? This cultural pressure that we perceive, and again, hypersexualizing things, or hyper perfectionism in the form, and filtering. We could go into the social media filtering, all this right. That's a whole conversation right there. But let's have you handle that for a moment, and then I want to, maybe we'll put the book down for a minute, and then talk broadly about your practice and what you do. But maybe we'll leave that because it's covered in the book, and I think this is something profoundly apparent in our culture.
It's so bad. That relates to something Mark Miller had shared in one of the podcasts he sent earlier about doom scrolling, and how he said, when you're doom scrolling, you're inundating your brain with expectations for how the world should be.
Right.
And so that relates to that, because everything we see online is very intentionally cultivated. So everyone is projecting a certain image, not just how they look, but how successful they are, and just how their world operates. And we use that as a comparison for ourselves, or what we think we should be, what success we should have, and what have you. That's why I'm like, I always tell people, don't do social media.
Yeah, which you said earlier, right? Which I agree, right. Right.
Yeah, or if you do, I mean, it's not all bad, because again, we talked earlier about how people are sharing their experiences. So that part can be good to reduce stigma and increase connection with other people and their stories. But I would say, you have to intentionally set your feed, right? Get out of the algorithms that make you feel bad, and into ones that have the kind of information that feeds your soul and just moves you forward, doesn't crush you.
I think that's excellent. Yeah, it's like connection curation or something. Like you said, you can train the bots, or whatever Instagram is feeding you, or for me it's YouTube, right? If I watch one or two things, then it inundates you with all of this stuff, and it's like, oh, I'm so sorry, I watched whatever I just watched. That was it. I'm good. Yeah. But no, I think that's just caveat to the engaged is, this is fraught, and like you said, it's a double-edged sword, the wonders of connection and immediacy, that we have to be vigilant, I guess is maybe a good word.
Yes, that's a great word. Just be aware of what you're consuming and how you're feeling while consuming it. Yeah.
And you and I talked in our pre-meet about, I'm certainly older, and I won't speak to your age, but you're not 20 years old or 18 years old. And so, your coming of age, and I certainly know mine, and we both agree that we were not digital natives, but this speaks to the idea of digital nativity, or whatever that word is, and the, perhaps it's not ignorance, it's just not knowing the distinction between a curated simulacral world of social media and whatever else, fleshy, messy, gooey reality, of being in physical spaces with physical people. And I won't editorialize about it too much, but that is an area of interest to me, that we have a generation coming up behind us that is experiencing that. And in fact, I had another person I was on a Zoom with a moment ago, and I was saying that it seems like, and this is something you can answer to, is the field of mental health care and those presenting, that dynamic is going to shift, I think, and it is shifting. But like, as these persons age and come of age, and they get in their 30s, in their 40s, you could correct me, but I think I'm intuiting that mental health care will have to pivot a little bit just to bring on this nuance of cyber mental health or social media mental health, right?
Yes.
The avatar mental health.
Yeah,
what do you think about that? You're in the biz, so you're a
so
therapist.
yeah, I did not I did not grow up with social media. I was very much an adult when like Facebook started, when that started taking off. So that part's all new to me. But I'm now seeing people in practice who are, 20 some odd years old, and these things have been available their whole lives. So for me, the internet world, social media is very not real. It's completely fake. For them, it's very real. Yeah. It's something they're very well integrated with. So they create their worldview surrounding that. So it is hard to break through to that because they don't quite understand what I'm trying to say. I'm like, I remember the world before. There's a real world out there,
Right.
So I do think we have to pivot, and I think we probably need more research in how to effectively do that. But that's conversations I have every day with people because it creates that comparison. And the shame that comes from that of like, I'm not where these people are.
Yeah. And it's not as easy as just saying it's all fake, because there's,
to them,
as that
real.
guy, right. And as that guy, Mark Miller said, that there's the executive ego function, and then there's more of a subpersonal self that validates that, and it uses in its calculus and algorithms and prediction models. And so that's the meat and potatoes of the, where you can have this conflict, where you see these people in Bali having a wonderful time, looking fabulous and, flawless lives, and, and you can be dismissive of it and say, oh, well, it's, it's hype, it's BS or whatever. But there is this, I think, this underlying thing that can generate that. And then so there may be some rumination that arises from that. And it's like, well, why am I not in Bali looking like that and, having this fabulous time? Right.
And that feeling, that experience is very real, even though it's not real. It's based off of something not real, but to their internal experience, it's very much happening.
It is. Yeah. So, here's to good interventions.
I'm hoping because sometimes I'm like, I don't know how to translate this.
Yeah. And the other thing this could be me being idealizing and escapism and stuff like that, but I'm also wondering if we'll reach a critical mass of saturation and exposure and in engagement. Because one thing I'm noticing, and I could be in a bubble or a niche, but a lot of people are rejecting AI in their lives. I hear so much commentary, or I read commentary in comment sections and feeds and live things, and they're like, no AI slop, or, this is AI. And, there's a lot of pushback on that right now. And, to attach a disclaimer to that, I think AI has its place in where we are. But I think a lot of people find that just to be a bit much, to be so engaged. And maybe there are others who are like, yay, AI, and they want it to be their lovers and their friends and, whatever. But it'll be interesting to see how those chips fall too, right? With chatbots and virtual friends and, all that weird stuff. And it's like, that on top of what we just covered with social media, it's like another layer.
It's a lot. Yeah, I'm seeing more and more of that, and people using ChatGPT as a therapist, which is not great when you're not getting fully accurate information.
Right.
We see people using that as a boyfriend, girlfriend, as a friend, and that, it's not really giving us the skills to connect with people in the real world. So it's having an effect on dating and sexual intimacy and emotional intimacy.
And going back to, sexuality, I mean, you can build a virtual girlfriend and you can have virtual sex or do, virtual fantasy play, all that stuff is out there. And it's like,
it's,
for me,
it's fine. To me, it's fine, but that
if you don't pathologize,
not going to translate. It's not going to translate into a real world scenario if that's your goal.
Maybe it's like drugs. You'll get bored with it after a while. There's there's a dangerous addictive stuff like methamphetamine, but like marijuana or, like mushrooms or anything, eventually you're like, I've done that enough time. I mean, that's me. I did that stuff and I'm like, I'm done. This is boring. You just reach that saturation point. So maybe that talisman, the eros of the specter of AI's charms and all that, maybe that tarnishes. And like I said, we hit this critical mass and this overexposure, and wouldn't that be great to have a renaissance like Gen B or Gen A or whatever would be like, I'm going outside, put your thing down and go outside.
They might.
That would be the greatest revolution in humanity, right? and all the poor tech companies, what do we do now? We have to build cyber trees and cyber squirrels and have them interact with them.
Don't put that
We're going
out there.
3D. I'm sorry. Yeah, I don't want to put ideas in heads, but I could fantasize. I can dream. But anyway, so Nurturing Desire, love it. I will have links down below for the audience to access the book. It'll be out Thursday. What's the day? The number of the day? What's today? Like the 16th or something? 15th. So
it'll be out February 19th.
19th. Okay, perfect. So yes, I will have links down below to access the book and to purchase the book if you desire. And I, again, for what it's worth, I thought it was a well written, well put together book and very interactive and very helpful. So I appreciate that you did it. I know it's going to change lives. It's going to be helpful. So here's to that. Here's to its success.
Thank you. So
as I mentioned a moment ago, to bring the conversation in for a soft landing, let's find a little bit about your brick and mortar practice, your colleagues, and what you do. The day to day of your practice.
Sure. So my practice is Transcendence Counseling Center. We have locations in Vero Beach and Melbourne, Florida, but we see people virtually all throughout Florida.
Oh, okay, good.
Yeah. So it's a group practice. I have 4 other clinicians that work with me, and we all see very different issues. I'm the only sex therapist, but we have people who specialize with addiction, with anxiety, with depression, with life transitions. I think we cover the spectrum of issues, of concerns,
I can see a funny commercial coming. You got a problem. I got solutions. Look at this team back here.
We got you covered.
Yeah, that's it. That's it. Your one-stop shop for all that ails the headspace. So, and it was funny because I found you on one of these podcaster networking things, and we're both in on the Treasure and Space Coast, and that's neat. You're the first guest I've had that is regionally convergent or adjacent or however that's said. But that's kind of neat. So go Florida.
Right, go Vero Beach, such a small town.
Vero Beach, and, Bombay and all that. But anyway, now this is something I like to ask of people who are creative or doing good work, and that is in your Imagineering cloud, do you, or your thought bubble of the future, do you have, are you aspiring to anything beyond? Obviously, you have this book coming out, so it's like not like you have to do this. You've got something really creative coming online, but what are you imagining for yourself down the road? Is there something you're like, wow, I'd really love to do that?
It's a good question. I've been asking myself that because getting this book out and traditionally published was the last life goal I had. And I, just turned 40 last year. So I've reached all my big life goals. Okay. So now I'm trying what is next. So I probably want to expand the reach of the concepts that explore nourishing desire. So that might be a client-facing course or even a professional training for other clinicians to be able to help individuals that come across, some of these issues. So I'll probably pivot to something like that. I have a couple other book ideas as well that I may or may not pursue. We'll see how this goes.
Right.
It's been stressful. But it'll probably be focused on just expanding the reach of the concepts.
And teaching others. I think that's great, because I think we touched on earlier in the conversation that you're in a unique space with the overlap and and I call it a tapestry, like the synthesis of the two. What are they? Are they? It's not pathology. It's not. What's the right term to say? Sexual dysfunction and eating disorder. Are
comorbid.
Comorbid. Okay, so morbidities. Okay, okay, all right. But you're so the comorbidity is unique, and it's a signature that I think again, there's, to put it in horribly crass terms, there's a market for that. There's a population for that.
Kind of, yeah. The more I started talking about it, the more people are saying oh my gosh, I've been having this issue and no one really understands it. So that's why I'm have the book coming out. I'm trying to talk more and more about it, because when I was writing my dissertation, there was one other person that I found that kind of worked with both spaces. That was Dr. Judy Scheel, and she ended up on my doctoral committee. One person that I could find, at least in the United States. So there's not a lot of people that are trained in both.
Okay. See, you're in novel territory, not a novel ecology of comorbidities.
So hopefully more people
Yeah.
can learn to just spread the awareness.
Yeah. Well, Jessica, this has been a wonderful conversation, and I really, again, I wish you bon chance with the book, and all the best to its life in the public commons. And if something comes up and you want to come back and talk about something or have another conversation, you're always welcome to come back if this was a good experience, and love to have you. But in the meantime, I will watch from afar the blossoming and the continuation of the good work that's being done. So I appreciate it. Yeah, of course.
I appreciate that.
Of course. I appreciate having you as a guest, because
thank you.
These are the ideas that I like to explore, human flourishing and well-being. Here's some more of that. And how do we get there? And how do we maintain the best we can, I guess is maybe the right way to phrase that.
Absolutely.
So I will say goodbye to you after we stop record, but to the YouTube audience and to the Spotify audience, I hope this was a nutritive and informative and desire-provoking conversation. Get those words in there. But yeah, I hope this was a good takeaway for you. Again, any information relating to the book, as well as Dr. Singh's site, will be made available to you down below. And again, I really appreciate your presence and your engagement. So thank you very much. And
thank you for having me.
Yes, of course. And like I said, I'll say goodbye to you in just a second. But take care, you two people.